Now let's have a look at the number of nCoV cases around the world. Jess De Los Santos joins us from the newsroom. Jess, what are the latest numbers?
Okay, Robbie, what we have here is the Johns Hopkins University map, which tracks the spread of the disease in real time. Just to give you an idea here, let's run through the dashboard here of Johns Hopkins map. You'd see here on the far or right-hand side of your screen, they give you a detailed outline of the number of cases here per country. At the same time, it features a map which practically shows you how widespread the virus is. Now, on the left-hand side of the screen, you'd see here as well the total number of deaths as well as the total number of patients who have managed to recover. Now, let's first go through the total number of confirmed cases. So far, there are now 20,679 cases globally. A big chunk of that coming from mainland China, where there is now close to 20,500 cases. That is followed by Japan with 20 cases. Thailand also has 19. And then there's Singapore with 18 cases. And take note that Singapore has already reported their first case of human transmission early this afternoon. Now, I want to divert your attention here on this map right here. Let's go full scale on this one. You'd see a big concentration of the cases, like what I've mentioned earlier, is in mainland China. And in fact, if you try to zoom in even more, you'd see it's really majority of the cases are in Hubei province, of which Wuhan is a part of the epicenter of the virus here. You'd see in Hubei province, there's now 13,500 cases, and there are reported 414 deaths. And that is going to be a very significant number here, considering the total deaths globally is now at 427, over 400 of that coming from Hubei province. Also, very important to take note of, when you're looking at the number of total recoveries here, you have 397 already coming from Hubei province. Again, globally, the total number of patients who have managed to recover is already at 697. Now back to you, Robbie.
Thank you, Jess. Now, after initial problems in finding a funeral parlor, the health department says they have now found a new facility that is willing to cremate the body of the 44-year-old Chinese national who tested for nCoV in the Philippines. Health Secretary Francisco Duque says the Federation of Chinese Chambers of Commerce retracted their agreement to cremate the body. Duque stresses that the remains of an nCoV patient is not infectious and that the DOH is equipped to handle the matter properly.
Wala na ho. Hindi na ho magiging carrier. Pero naka-sealed kasi ito, naka-sealed body bag ito. So talagang kahit na may agam-agam, yung pong measures ensure that this is still, and therefore the coronavirus will not be able to get out.
Despite the health department's assurance that they're on top of the nCoV crisis in the country, senators think otherwise. Mayan Los Baños reports.
It was in January 21 when the two Chinese tourists who tested positive for the 2019 nCoV ARD arrived in the country. But in Tuesday's Senate hearing, it was revealed that the health department has not yet conducted contact tracing on all of the two patients' co-passengers.
Yung hotels and restaurants, understandable, mahirap yan. But yung aeroplano, una-una, may ano yan, di ba? Meron namang listahan ng SEPAC, saka may flight manifest. Di ba dapat ngayon pa lang, for me, dapat, Secretary, 100% na alam na ng mga pasahero na yon na they've been exposed to the virus.
But Health Secretary Francisco Duque clarified 17 epidemiologists and 40 surveillance officers have already reached out to at least 50 of 331 passengers. He pointed the blame on airlines withholding information.
I'm told that these airlines are invoking the Data Privacy Act. I don't know how. This is rather strange. In a time of urgent, situation.
But the Civil Aeronautics Board and Philippine Airlines were quick to defend themselves, saying they're only following orders.
We already submitted the names of the passengers. As of the moment, we were able to contact a total of 74 as advised out of the 132.
Transportation Secretary Arthur TUGADE pointed out miscommunication. For him, the DOH should be coordinating with the CAAP and the Civil Aviation Authority of the Philippines. But Duque said they're too caught up with the virus, but this did not sit well with some senators.
It is also a failure of leadership on the part of the health department.
The DOH should be in charge
on top of this situation. Not the CAAP, not the BI, not the DOTR, but the DOH.
The health secretary vowed that they will boost their contact tracing efforts in the next 48 hours, as well as probe on the possible reason for the supposed slow response.
I have always assumed that they already have the competence, they already know what they're doing, they are familiar with the protocols.
The Interior Department and the Philippine National Police have expressed readiness to help the DOH. Reporting for News 5, Mean Los Baños, we are One News.